Senator Gretwick, distinguished members of the committee, I'll recognize my district senator, Senator Whittemore. Good afternoon. I'm here as a firefighter for the city of Bangor and to speak in support of LD 1345. I'm going to tell a story to the committee that took place in 2014 between the city of Bangor and Anthem Blue Cross Insurance. The city employs roughly about 500 men and women and provides health insurance to us and our families. In 2004, Anthem was proposing an increase in our premiums of 57%. I was told it was due to a higher than normal incident rate for the previous year. The city called all its executive officers and all the union leaders to meet at City Hall to meet with the representative from Anthem Blue Cross to try and negotiate a lower cost for premiums. Historically, the city has been well below the national average as far as claims and incidences in premium increases, averaging about 7 to 10%. I work for the fire department, and I know that we at the department had more than an unusual number of incidences. 2 of our fire officers' wives were diagnosed with terminal cancer. One of my brother firefighters was involved in a serious motorcycle accident where he was flown by life flight, required numerous surgeries, and spent months in the hospital. Another firefighter's wife gave birth to premature twins. They required an extensive stay in the NICU at Eastern Maine. The meeting between Anthem and the city of Bangor and its workers took place at City Hall in the council chambers. Just before the meeting was to begin, a police officer walked in. His name was Jimmy Owens. He's now retired. He was carrying some paperwork. Officer Owens proceeded to hand each person in the room a copy of the recent article. The headline of the article read, Anthem CEO to receive $42.5 million merit award. The police officer kindly asked the Anthem representative, how do you explain this? Even after the negotiating with Anthem, we still had to pay roughly about 52% increase in our health insurance premium that year. We cannot continue to deal with these skyrocketing costs. There will reach a point where the city and the workers cannot afford to hold adequate health insurance or health care for our families. That is why I support LD 1345. We should take health care out of the hands of the insurance industry and put it back in the hands of the people. I believe we should make health care a human right and enact a universal health care system here in Maine. It is the only way to ensure that everyone has access to health care they need. The insurance industry is only concerned with increasing profits by denying care. We must take charge of our own health care and ensure universal access. Please vote for LD 1345. Thank you.